But I look at exercise or activities for people as being kind of the marathon of life. It's like, don't blow it all in your 20s and lift all this weight or run millions of, the marathons. It's like, space them out over your lifetime. You've got the life expectancy for people is getting bigger and bigger. So if you expect to be 95 years old, you can do a little bit each day.
Right. Hello and welcome to the Weight Free Wellness Podcast. I'm Tara Bachland, the creator of the Weight Free Wellness platform. And my guest today is Erin Blackford. She is a physical therapist in the Minneapolis-St. Paul area. And today we're talking about, of course, physical therapy, right? But also how it's not just for people who have experienced injuries or accidents, but how it can be used for preventative maintenance, one of my favorite topics. And she discusses pain, also how we can use the healthcare system to benefit actually us and the system even better, how we can use it more wisely, and even how we can prevent simple things like that are really critical actually as we age, like falling. And so we get into a variety of really helpful topics here in this casual conversation that I invite you to enjoy. I also want to put a little shout out there. This summer, I am taking on an intern who would like to learn more about online business, online marketing, all kinds of things that are related to that, including, of course, health and wellness. I'm looking to fill this position in early June of 2017. So whenever you're listening to this, then you know what's going on. Have that person, the college age student who is looking to learn a little bit more over the summer, over their break. And it's not a full-time position. They can work remotely, basically from anywhere. So it's probably about 10 to 20 hours a week. But as you can tell with this podcast, I'm all about learning and teaching and sharing and helping. So this is not going to be just a menial task position. It's an opportunity to learn a ton about this type of business. So I welcome you to tell the young student that you may know about this and contact me at weightfreewellness.com. Well, Erin, thank you so much for joining us today.
Well, thank you for having me.
I'm really excited to talk to you. Now, we get plenty of talking in when I come in for a physical therapy session, which I really appreciate. I love being treated, going in for a service that is not just like in and out, like let's get you on the revolving platform. So thank you, first of all, so much for that. But one of the things, I'm jumping ahead of myself. So I've come to you for physical therapy. But most people would be like, if they knew me, they'd be like, Tara, why are you going for physical therapy? You can move better than most people I know, at various ages, but especially our age. And to me, wellness, as I teach in this podcast, is really, it's a lifestyle. It's to keep moving well, and if not, improve. And so we'll get into that, and because we share some of that same philosophy, and you definitely see a lot of that, the different perspectives. You are a physical therapist, and you actually come from a family of physical therapists.
I do.
So will you share with us some of your background? Like, did you know right away that you were going to be a physical therapist?
So no, I did not know I was going to go into physical therapy. My dad, so he is a physical therapist, and I obviously have been around it for a long time, see kind of his path and where he has kind of come from and gone to. And I knew I wanted to be in medicine. I wasn't really sure what that was going to entail, but then I started looking a little bit deeper into what types of care would I feel be the best for me. And I have been a lifelong athlete myself. And I think what kind of pushed me over the edge is that not only am I a physical therapist, but I used physical therapy kind of way back in my high school and collegiate levels of playing sports. And so then I decided, well, I might as well start that track and start seeing how I can navigate that. And I started to like the schooling, the anatomy, taking care of people, all of that. And so my dad when I was going through physical therapy school, actually left a company and then started his own company, which then probably opened up my eyes a little bit more, knowing that I could potentially work with him and not have that issue. So that even drove me a little bit further into seeking those goals out and achieving that. So, and then my brother came along afterwards, and he wasn't actually really interested in PT to begin with, but I think he saw the dynamics between my dad and myself working, and applied for physical therapy school probably, it must have been 5 or 6 years after myself. And he got in and came out, graduated, got his license, and here we are all working together.
What was so interesting to me is I don't know if you actually do some of the stuff. I saw some equipment back in the back room, a big back room, but my first, I call them adjustments, they're almost like chiropractic adjustments. So I'm curious to hear more about your philosophy and how you think you differ.
Yep. So we get asked that quite a bit, just, what's the difference between the traditional physical therapist versus like the chiropractic realm. And so obviously we're still trained as physical therapists and go through all of that education. And I think in the traditional physical therapy world, people kind of get caught into, they typically do stretches, exercises, and send you on a home program and off you go. Physical therapy has a huge umbrella, and so there's also slivers of different types of care within that. And so the manual therapy, which tends to be more of a smaller branch of physical therapy, is what we were into. And so we're taught part of that in school, which is great, but there's not a significant influence or emphasis on that. For whatever reason. It is internationally a huge area. And so we've learned a little bit of that training just from like different environments whether it's Chile or New Zealand and Australia have a lot of manual therapists. But then when we look at what physical therapy is against what chiropractic is, I think, both avenues are awesome. And so when we look at chiropractic, I think what they're taught is even doing more of like a manipulation type thing, or high velocity or high thrust type movements. And so it's the definitions. I tell people we're probably in the same book as we still want joints to move, and our underlying goal is to actually decrease pain for people, increase their movement. But what pulls us apart is probably the techniques that we're taught. And I think there are really great chiropractics out there and great PTs, and it's just finding what is very specific and individualized for a person. Because some people might like more of kind of that manipulation, where we're just tending to not do it. So we're still having force, but we're not doing it at that manipulation level. So that's kind of what pulls us apart. And it's like a gray area. It's not definitive, and the definitions aren't the best always for manual therapy, because there's a lot of people who will say, yes, I do manual therapy, but what they do is completely different than what we're taught and what we look at.
Mm-hmm. So is this something that your dad really focused on, and so kind of passed down in a way?
Yeah. So what happened is he actually got into doing a lot of like continuing education courses, and one of the big continuing ed organizations when he was going through it, a guy named Stanley Paris. And so he does a ton of manual therapy. And my dad actually took a bunch of it and made it as a little bit of a hybrid. And so we do a little bit of everything. And I think that's what's unique, is that we don't get stuck into one area or one technique for people. It is kind of a cluster of things that are put together to try to facilitate something to be better for the patient. And so from then, we've kind of played with it, adapted. We've had fabulous patients who have let us try things, because if they're getting nowhere, we're kind of the last resort for a lot of patients. And so they're letting us try, and it has been successful. We have a great following, and we see results.
And it sounds like quite a variety of patients, from
Yes.
those who have had long time injuries to athletes.
Yep. So we have, anything from our lay person, the moms, the dads, the workers, taking care of houses. And then we do see some of the elite or the professional athletes come in. And so they find that our little niche has been so helpful for them. We definitely look at if we can facilitate people to move better, have decreased pain. They're actually going to go out and do their exercise or their performance at a higher level. Because even when we look at some of the professional athletes, there's no way I can actually even have a gym that would be significant enough for them to either work out in or lift enough weight. They go back to their facilities and then can perform.
So it's interesting to me, every time I've heard about physical therapy, because I promote a lot of wellness care therapies, people think that something has to be wrong first. Right. And would you say that the majority of your clientele are coming in because of injury?
Yes. Yeah. Or irritation. Definitely. I think that gets into our healthcare system is that we're looking at, do something when you have a problem versus trying to catch it prior to having an issue or a condition. So, I think most of them are coming in because they've went to their physician and saying, I'm neck pain, back pain, elbow pain, whatever. And then they get referred to physical therapy.
And so we talked about pain last time I was in, and I'd like to get a little bit further about, because you kind of have a philosophy about pain. And I probably could ask a more specific question, but I kind of want to let you roll a little bit.
Pain is kind of an interesting thing because unfortunately it's one of the last things that signals our body that something's wrong. And so if we can actually catch pain prior to it getting bad, usually then you're flipping and you're making something be more preventative at that point in time. And there are actually signs and symptoms that people can pick up on, whether it's tightness or lack of motion, or even their function has started to deteriorate for whatever reason. That's usually when you want to try to see if you can catch that. And you can test for those things, which is great.
How would a person notice that in their day-to-day life?
Usually people will start to notice whether it's, I can't squat down and, do an activity, or I can't change lanes and look over my left shoulder. But I don't have irritation. I just, for some reason, am not able to do that. And so at that point, I think that's when, if we could be better at checking those things and making sure they're right, people can actually not go into pain, take care of it, stay out of it, because there is, once you hit that threshold of pain, then it's been there for a while. Pain doesn't just come on. It's similar to like even people who have a heart attack. You have your event at one point in time, but there's usually a lead up to that over even a few years. People will start to recognize even prior to their heart attack, I'm having maybe some chest irritation or palpitations. They're minimal. They associate it with some other thing, and then they have their event. But it's usually a buildup over a period of time, and that's when we want to try to catch it if we can. And one of our goals, even at physical therapy for what we do at Motion Care, is to actually educate people on recognize when something's happening, because if you can recognize something's happening, it's usually at a minimal level, which is much easier to take care of, versus when it's the big flare up or the acuteness of something, harder to decrease or diminish, even though you can still decrease it. It's just a little bit harder.
And it seems to take levels of awareness. Those of us who use our bodies a lot, I do dance, martial arts, yoga, I've developed a pretty good relationship with my body, which is also the advantage. It's, the more it's a healthy pairing, It's healthy to exercise, and you develop this relationship, when your body's off,
right,
that kind of thing. But even if a person is simply going for a daily walk, is wonderful.
Right.
Creating that connection and awareness seems so important and so key. So your body doesn't have to start screaming at you to get your attention.
Right. Right. Absolutely. I mean, I think, and you nailed on it. I mean, most people who, and we're fortunate, I should back up. We have a very good patient population who is highly motivated, going to try to take care of their body as best as that they can. And so they are doing the movements, they are doing their activities, they're going to their Pilates or pump class or kickboxing class. And so they're able to actually recognize when something deteriorates. And that's usually when they'll pop back in. And it's good. I mean, sometimes for us as therapists, we sometimes joke at our clinic because we create a little bit of a monster in patients where they start to become so attuned to their body that they become nitpicky, which is good. But as a therapist, sometimes you're kind of sitting in front of them and they're like, it's right there. You don't have it quite yet. Which is good. I mean, we do want that, but they become very attuned to what's happening with their body, which we want that in people. We want them to be able to pick up if something's not right or wrong, and to help to facilitate it better, or help to even channel them into the right avenues. Because if they can be picky with their body, they might, if we're not successful for whatever reason, they might go, something's different than what I've had in the past, and drive their healthcare faster to take care of something. Lots of benefits.
For sure. Yeah. And you use a lot of like, okay, what does it feel like to you? Where is it? Yep. I can't feel it. So how can, just trying to clarify that communication even better.
Right.
So I had heard about you guys through, actually originally from my dance teacher. I recommended you then to my husband, who has had, I'd say kind of long-term issues related to, he's a former racer, so there's a lot of banging and abuse over the years from doing that. And he had amazing results with you guys. And he's like, you have to have them adjust your facet joints. You'll think it's their wrist popping, but it's like,
right.
It's like when you're in your physical fitness and stuff, it's like geeky kind of stuff. Like,
yeah, absolutely.
And so I first came in because I noticed that my right hip had been kind of tweaking a little bit. And what I mean is like it pulled just slightly, but when you're doing a lot of stuff, slight to one person can be a lot to. Mm-hmm. And I certainly didn't want it to get any tighter because my hips are already an area where I have to work on flexibility and range of motion.
Yeah.
And it was very interesting to me how, you described you work on different planes of motion. Mm-hmm. To address an issue. Do you want to explain that a little bit?
Yeah, so we work dimensionally. I mean, we work in the 3 dimensions. And I think we don't always look at that in physical therapy. And I wasn't really taught all of that, because one of the things that we really forget about is the longitudinal movement that people have. And that's what we all will fight throughout our whole life is when we stand up, gravity presses us down, the floor shoves us up. So we're the ones in the middle that are constantly being compressed. And if anyone's ever had an incident or accident, usually there's this quick seizing or this compression that will occur to help guard an area. And so that motion of trying to decompress is huge for people. We also work in rotation and diagonal movements to try to facilitate facet joints, SI joint, or even elbows and wrists. I mean, you can do it in any joint to try to be better. We always want to test before we treat a patient, so we try to do a little bit of a cluster of tests before we even look at even treating someone, just so that both the patient and the practitioner are on the same page. That's kind of like our communication back and forth, because unfortunately we can't feel people's pain. It's good to know about it, but we can't feel it. So if we can have an objective measure, whether it's motion, muscle spasms, palpation, we know we're in that right area. Then looking at those planes of motion to see, can we actually facilitate it? And we might be repetitive with it, because if we start to get something to move, then we might have to go back and try another move to see if we can get more and more, because it is a little bit of a domino effect of if you can get one area, then you start wiggling in another area, then you kind of go back. And then we always look at doing then the post exam, what we would call it, as checking what we did in the pre-exam. And again, that's our communication back and forth to be able to see, did we get something to change within that amount of time? The biggest thing for people, what I always tell is even if we get a little bit of that change at the clinic, it's then you going out and doing your regular activity or your exercise program. That is the proof right there. Do you actually get something to feel different if you're in ballet or if you're out for a run, or even if it's just for a walk or going up and down the stairs at your house? Just something feel different or easier. I just had a patient, which was interesting because she may not have probably the best sense of body. And plus she has 2 total knees, which give you a different sense of body.
Replacements?
Oh, total knee replacements. Yeah. And what she told me, she said, well, I came back because I'm not really sure. I can't really tell if something's changed completely. However, she's like, I'm sleeping through the night. And the only thing I changed was coming to you. And so even when we look at that, you go, there was an objective measure that changed that she's actually aware of. And that might be her measure, which that's the problem with even trying to put people into cookie cutters. They should be able to do this or that. It's going to be very unique to each individual person. Can she sleep through the night? I mean, that's her goal now. And she should. That's what I would expect, is that should be consistent now. If we're at least improving her range, improving her, decreasing irritation, that should be her goal.
So do you ever give like routines or suggestions of exercises that people should do?
Yeah, I mean, it depends on the individual. But yes, I mean, I think an exercise component is valuable. Some people have figured out that they like their Pilates exercise program or their yoga exercise program. And I mean, they do show in some of the studies that really if you can get someone excited about doing their own program, they're going to be more consistent with that versus if I give them the 4 or 5 exercise program. So I really try to tap into, what do you like to do? And can we build on that? For the people who are like, yeah, I don't have an exercise program and I don't like exercise or whatever it is, I try to develop something that may fit them, which is still going to be minimal. I mean, we're handcuffed a little bit with how much we can do just at our facility. So there is, I mean, patients do have to take onus and take their life into their hands. So I really push that and encourage them to try to find something they like, even if it's just a walking program.
Yeah. It makes a huge difference.
Yes.
When I'm talking with people too, it's okay, well, let's find something that you like.
Yes.
And the thing is, there are so many things out there. We usually think of exercise, okay, I can lift weights, I can go on the treadmill, I can go on the spin bike. I don't want to do any of that.
Yeah.
There are literally hundreds, if not thousands of other things that you can do.
Right.
That would technically be called exercise, that you can find something that you actually enjoy.
Right. Oh, there is just, I mean, and they're coming up with more and more fun things and changing things up. I mean, Zumba used to be a huge thing and still is. We've got more people on rowers now than ever and taking classes. There is just, and you can just work out at home. I mean, you can do your own body weight. You just have to find that little motivation inside you to do something.
Right. Is there any kind of exercise that you as a PT just makes you cringe?
Oh, you know what? Honestly, if they do it and they love it, go for it. So, there's not one that is not good or, I think just if people can move, that is the biggest thing. Whatever lights them up, do it. It doesn't matter what it is.
Is there anything that you would like to kind of add to people's routines or make sure that they do?
Yeah, I mean, I think if people can do more full body type activities, that's much more functional for people. So not getting so stuck into, even if it's just, I like to just weight lift. I don't want to do anything else. I think the variety of doing an activity and involving your whole body is really important. I think trying to go through a full range of motion with activities. And some of the weight machines somewhat limit you on how big your motion could be. And then with that, knowing that as you go through life, it's going to change. So what you did when you're 20 is going to be different than even 30s, even 40s, 50s, and so forth. But I look at exercise or activities for people as being kind of the marathon of life. It's like, don't blow it all in your 20s and lift all this weight or run millions of, the marathons. It's like, space them out over your lifetime. You've got the life expectancy for people is getting bigger and bigger. So if you expect to be 95 years old, you can do a little bit each day.
Right. Yeah. Don't use it up all at once.
Right.
You don't want to be the person at 60 and 70. Well, here's part of my inspiration is in my ballet class. I'm actually the youngest one in class.
Oh, nice.
There are at least 3 now who are in their 70s, and they move amazingly well. And it's the funny thing is each one of us also has a story about nearly falling on the ice, and just by doing the ballet in particular, we all credit ballet, that it has kept us upright. And especially at that age, that's something you really want to avoid.
Yeah. I mean, falling, and as we get older, does become more of an issue. And it may not even have anything to do, I mean, some of it actually is just eyesight, medications people are on. And so ballet is a great activity because you're looking at your body awareness. Where am I in space? And you usually go through a big range of motion. One of the things that with falls is if people lose their hip range of motion, they have a higher probability of actually falling, and falling from upright standing. I mean, if you have the control to bend at your knees and bend at your hips, you're usually going to have less of a tumble. But people's hips range of motion tend to decrease as we go through life, and for a variety of reasons. But if you can, just like what you said, if you're the youngest person in your ballet class, look at all these people who are trying to take care of themselves and be as preventative as they can, put in good effort to keep themselves healthy, which they probably, I mean, if we could clone those people and say, okay, clone group 1, don't do anything, they probably would see that group actually deteriorate faster than the group that's at least trying something.
Mm-hmm. Definitely. And it's not an easy class just because they're all older. It's an easy class for sure.
I'm sure not. No.
So we've talked also, well, maybe what I'll mention also is, so I initially came in with this little twinge in my hip. Yeah. And the next time I was like, based upon what I experienced last time, I've always had this tightness in my upper back. And I just assumed it was after a workout, it was my structure or something. Mm-hmm. But I was like, so can we look into that too?
Yeah. Yep.
And that's when we got into the adjusting the facet joints. But you said it tends to come from the neck. And after that manual adjustment, it's like that my upper body was just freer.
Sure. Yeah. I mean, and you just even in that first visit to the second visit, that's the fun thing for us, is that you're actually learning about your body still. And you go, hey, now I can actually pick up that I am a little bit tighter through my neck and upper back. Is there something that actually can be done to this? Mm-hmm. And if we treat you, and like you said, you instantly feel like I received something, from the manual therapy that we do at Motion Care. You go, I know I got something, and now I know I can actually be better. Mm-hmm. One of the problems, what we see with what we do is a lot of people, 1, because of gravity, but 2, because of kind of the activities we do in our daily living, is we all fall forward. We fall into flexion, sitting over a computer, driving, cooking, whatever, we start to fall forward more and more. And so what you probably recognize too is we do a lot of stuff into extension to try to see if we can bring back. And I think that's what people will say to us is, I could stand up better, I could come back better, I felt less tension. And I guess going back to even an early question of activities that maybe we like or dislike, I'm huge on doing extension exercises, trying to promote people to be back with better posture. They get a lot into doing like the posture restoration, which I think is good. But if the mechanics can be better for people, then all of a sudden they can get back into their posture, and then you want to train it there. Because you go, now I want to reinforce this to be more correct. But going back again to, you actually were able to recognize if one area starts to change, now that tension I have up here, hey, people have an innate idea of like something's not right. Can we look at that and can we actually change it? And we have to listen to their gut or, whatever it is. Because I do think people really know when things are right and wrong with their body. As practitioners, we have to be good at deciphering that, because not everyone has the medical language to say, hey, my rhomboids are tight and they're connected to my, C7, T1, and so forth. I'm just tight.
Mm-hmm. Right. So you're talking about the back extension, and just to even kind of break that down a bit, was so interesting is that like the first thing that they suggest for babies is that you give them tummy time, and so you can do that banana. So just kind of give people a visual who don't know what the extension is like that, you put a baby on their tummy and they arch up and back to that banana position, which is so good for us too.
Yes. We should all have tummy time, right?
Right. I think we all do need it. Yeah. That was one of the main things that we focused on in yoga teacher training also, is doing the back extensions and simply doing that type of pose. You don't have to be doing a back bend, or a wheel pose.
Right.
You can be on your stomach at any age and just, be elongating, stretching out, then lifting up. It's not about creating that U curve. It's about going elongating out. So like someone's pulling you at your fingers and your toes, and curving up as well.
And that's looking at too, like they're trying to decompress, right? Because we have compressed all of our life. I mean, once we're born, boom, gravity starts to compress us. We start, and this is, you see it through life, where as we grow, yes, we're growing up, but as we start to age, which we're all aging all the time, there is this dehydration in our discs that is a very normal thing that starts to compress us. And so trying to facilitate that extension or that elongating is so important for people, whether it's through your fingers or your spine or wherever. It does help us stand up. I mean, we've all seen the little old lady that's forward, and she's probably spent a lifetime of just forward movement, whether it's cooking or cleaning or laundry, whatever. And I just want to push them back up as much as I can. And so we want to prevent some of that, because unfortunately, once you start falling like that, and the years and years of just the repetitiveness of getting caught forward, not that you can't change it, but it does become harder. Our tissue does have memories of where they were, how they are, and that repetitiveness of flexion is somewhat hard to bring back into extension. We have way more flexion than we do extension. So that's the harder area to gain.
Yeah, it's much more natural for us to go forward.
Absolutely.
And we see someone like that, it's at least a good reminder to, I know it makes me want to stand up straighter.
Yep.
Going.
Yep.
So kind of speaking of preventative care a bit, we've talked a bit about that. And obviously that's the train that I'm on. I'm a huge promoter of preventative care. And we had a bit of a talk like that, because in physical therapy, most people don't think it's necessary unless you're actually injured or you're hurt.
Right.
And you do have some patients that do come in as preventative care. And what do you see that does for them?
For them specifically, I think it's number one, they want to check on their body to make sure that they're going to be good going forward. So, and we're that tool that they use. I mean, I really do look at patients and tell them, use this as a tool or a diagnostic tool to try to determine if something's good or bad. But for people, I mean, they want that check, whether it's for a performance level. Some of them are athletes that they go, I want to come in and I want to make sure that I'm right before I go out and play my sport. For other people, it might be, I'm stuck at my desk 10 hours a day. And if I don't catch this before it gets really bad, then I'm in big trouble. So people do have an awareness, and the good thing is if people can kind of catch, like what we were talking about, am I getting tight or am I noticing something's deteriorating, that definitely pushes them to initiate seeking an appointment. Mm-hmm. And we don't always know what the rhythm is for each individual person. I have some patients who will go, I'm going to come in when I know something's deteriorating, so they'll not even put something out there. But then I have other people who are like, I come quarterly, or we come, every monthly, or I come every 2 weeks, and everyone's history is a little bit different, and that's what will set them up for that. Mm-hmm. But we are huge, and if you can catch it before it gets bad, it's much easier to control.
So what would be some of the signs that a person sees who's sitting at their desk a lot?
So a lot of people will have that forward head posture. I mean, they start leaning into their screen or into their work, shoulders rounded forward tends to come with that too. And then they lose their low back curve with that, because when we sit up, you gain your low back curve. When you round over, it's difficult for people to have that low back curve. So you're typically going to see that. And we've probably all walked past the cubicles and seen them all. The nice thing is now employers are actually getting better and better with having tools, whether they're the stand-up desks or different keyboards or monitor screens that you can move. So they're actually seeing awareness of, if we can keep our employees healthy, we're actually going to get better results with them, because they're going to have probably less time away from work. And I mean, not only are you seeing prevention as a big thing that we want to promote, but they're seeing it in the workforce too. I mean, they want to try to keep people healthy, which is awesome.
Yeah, we talked about that too, and I kind of want to move on to talk about even the efficiency in our healthcare system. Mm-hmm. I notice for myself, I sit down a lot doing this podcast, and I love doing this podcast, but it's probably the thing I least like is having to be at a computer.
Right.
So someday I look forward to that. What was it? Which movie was it where there's probably a couple movies where it's like a hologram and you're just around. I'm looking forward to that one, that computer someday. But I sit down a lot, and what works better for me, and it also, like I said, my hips tend to be tight, is I sit on the floor as much as I can. And it's really challenging at first because there's so many factors involved. You mentioned the stand-up desk. Are there any other really handy tools that people would recommend?
Oh, I mean, I like a variety of things. And again, it's unique to each individual person. The stand-up, sit-down type desks, even sitting on the floor. I mean, going back to like the exercise programs, if we can go through our big range of motion and get down on the floor, awesome. I mean, keep doing it. Yeah, whether it's playing with, if you don't have young kids, play with the cats or the dogs, or or if you're gardening, get down and move. I don't have it. Yeah.
The animals, my cats are just like, woo, where is
yes. Yep. I mean, there's not one specific tool that I'm like absolutely in love with. And maybe that just comes from, we have such a huge patient clientele. They do it all. I mean, it's amazing, all the things that are out there that work for every single person. I think that is the challenging part, is trying to find what fits for you. Mm-hmm. But yeah, I'm not sold on one thing yet.
Yeah. Well, I know for sure, I love, and my cat loves, when I go on the couch and I kick up the footrest. Yeah. I know she loves that. But I noticed about those chairs, it tends to like collapse your chest and curve your spine in.
Yeah.
And it can be so relaxing at times, but I notice I start breathing more shallowly,
Yep.
totally lose my posture. It's so easy to jut the head forward if you're working on the computer, especially.
Yeah.
And so, I really try to be mindful. And I even notice sometimes when I'm doing these podcasts, I do have the benefit of seeing myself in the screen.
Yes.
And it's easy in this chair to collapse.
Yep.
So there's so many things to be aware of.
Yep. And I don't think you need to have perfect posture all the time, or when we look at positioning like in recliners. I mean, you're allowed to get into the recliner and get cozy. But I get this question a lot from moms who are asking when they bring their kids in, should they be doing that, or how should they be with their backpack and so forth. And so I give a little break to both parties, the parent and the child. It's like, it's not that you have to live there all the time, but just like you don't have in poor posture, but just like you don't have to live in perfect posture all the time. I mean, that variation, that's going back to exercise. We want the variation of getting in and out of certain positions. But it's easy to slouch in those big chairs and get cozy and fall asleep.
Totally, it is. But I like the philosophy too. It sounds like you're talking a lot about a happy medium. Find what works for you. Of course, move towards health as possible. But don't make yourself crazy either in trying to reach this certain ideal. Yeah, no, I totally. That is. You have to find what fits for you. It's a hard thing, and it's hard not to reach out to the extremes. Because we have some people who, going back to even running the marathons, I mean, they're all the way on one extreme where they're just doing so much repetition, so much wear and tear. And then you have the other people who, they sit on the couch all the time. And it's like, neither probably are really great for you. I mean, you don't need to push your body to a limit with a marathon or a workout program that is so intense that you're breaking down. But we also don't need you sitting on a couch 24 hours a day, 7 days a week either. Can we get a little bit of that middle ground? So when we were last together, I think it was brought up a couple times about using our healthcare system more efficiently. And we didn't really get into it fully, but I'm still so curious to hear from your perspective on how you see our healthcare system. What I heard was you see it being used inappropriately and it could be used better. Yep. What do you mean by that? So I think it goes back to, people being educated, just number one, being educated about the healthcare system, but number two, a huge thing of just being educated about their bodies. And I think that falls on a lot of practitioners to be like, can we provide good information for people to recognize when things are correct or not correct, and then where to filter into the system with that, whether it's, we do have direct access for physical therapy. So if someone knows something's not correct because they've learned that from maybe their primary care physician, can they actually seek care versus going through the hoops of, I need to go to my primary doctor, then they want me to do an x-ray, and then, all this stuff where they're just spending more and more money. So that's probably the biggest thing that I see is, again, it puts onus on the practitioners to be better about, can we provide our patient populations with information on how to actually pick up on when do I seek certain types of care. But yeah, that's a hard way. That's a hard thing to change, I think, for people. I think we have to really start when we're pretty young, which I think you can do. I think you can start even in the school age, to try to give them information from a physical standpoint on what does it feel like, how, participate in activities. Let's get recess going so people can know what's going on with their body, and then listen to them. I mean, again, practitioners have to somewhat decipher what people are saying, because when patients come in, a lot of times they're like, well, I'm here because I have pain. That doesn't give us a real good descriptor of what's going on. So we have to be able to kind of pull that information out of them the best that we can to help guide. So we need to be better at that. Yeah, I was kind of catching that vibe when we were talking, that there's such a mindset, it's almost a mindset shift that needs to happen. And I agree that, starting, if the health classes, so one of my programs, I teach really about developing that communication with your body. Eat this food or eat a food. How does that feel? Start doing a certain kind of exercise. What are you noticing? And, kids actually can be quite aware.
Oh, absolutely.
And it can really be begun and probably be more of an exciting health class.
Yes.
In that regard too.
Yep. Nope. I think kids are very aware of what's going on with their body. Sometimes we push it off to, if they do have irritation or something's not right, it's growing pains or it's, something they fell down or whatever. But kids really do. They're great because they can pick up on their body. That's our population. So we don't do a whole lot of getting out there to kind of advertise per se. So we end up getting a lot of the children of some of our former patients. And so those children, grow into the high school, college, and then now working, or moms where they actually are so good at knowing when they need to come in or not. So it would be great if we would have kind of kept the longevity to see who those people were, but they know when they're right and wrong. And as young adults or into their 30s, they're starting to pick up, which then they do drive their care much faster, use it much more efficiently, spend less dollars, which is fabulous.
Are you saying you think the money is wasted just in the runaround?
I think sometimes there's a little bit of a runaround, partly because pain's a mystery. Pain for people does like I go back, it doesn't give us a good descriptor of what's going on. And so they do a ton of testing to be able to pick that up, which a lot of times the testing's one or the other. It'll come back negative, or it will come back that they have something, even if it's an arthritic change that's occurring. But even a physician at that point in time will go, well, that's a normal degenerative change that is appropriate for your age group, so we're not going to do anything. Mm-hmm. And so now they're left with, okay, so now you're not going to do anything, but I still have my irritation or I still have my pain.
What, in your opinion, what else could be done?
So I think then when you look at whether it's the alternatives of the physical therapy, massage, even chiropractic work, other yoga or Pilates types exercises are a great thing to try to at least facilitate them to move into a better direction, because really arthritis, it's not a good diagnosis and why people have irritation.
Either type of arthritis?
What do you mean either type?
Rheumatoid or osteoarthritis?
So the two difference, that's where I thought you were going with that. So the osteoarthritic irritation or arthritis probably is something that we can benefit even better. I mean, some of that it is a normal degenerative change, but usually what associates with that is that movement then is altered or changed because you have some form of structure that's changing. So I do think getting into those people into a yoga or aquatic or spinning or whatever does significantly help them to be better. The rheumatoid arthritis is a little different because they do have to do more of the medication therapies to try to control some of that, along with, for physical therapy, we watch for if they go through an acute flare-up, because it does actually change the ligamentous and muscular structures during those flare-ups. So you have to be a little cautious. Both parties need to move, though. They need to do their activities, but they might find it a little differently just because both movements will change, but they have different indications of when they should be active or when they shouldn't be active. Does that answer it?
Yeah, I'm thinking of the audience and what might be some literal pain points. And I have heard too of people at least greatly reducing the rheumatoid arthritis, since it's an autoimmune response, just by eliminating certain foods. Maybe not it being gone, but there are a lot more autoimmune protocols these days.
Yes.
And how to treat those naturally. So I want to put that message out there too, to not give up hope that there's actually a number of ways to remedy things these days.
Right. Yeah. I mean, we're having more and more patients who actually do start to decrease like the glutens or the sugars, and they make a huge difference for some people, which is awesome. Mm-hmm. And so, yeah, I mean, those, not only is exercise and movement a great thing for people to do, but yeah, you have to look at the foods you're putting inside you too, because that can play a huge part.
Mm-hmm. So, kind of wrapping up here, what are some? You named arthritis, but are there a few other pain ailments that you think are mismanaged in the current healthcare system that involve PT?
Oh, probably a lot of them. I mean, I think. Really, our population, they did this study, it was kind of interesting. 98% of people in their lifetime will have some form of back pain or irritation. That's most of our population. Yeah. That's incredible. So we, at one point, I mean, I've been a participant of that too, have had some back pain. And I think those are not, I mean, there's a lot of people that have it, and they've gone through a lot of stuff. And if we can find things to help people be more educated on back pain and what to do, I think that's just going to make them better and better, along with help prevent things or diminish things in the future. But back pain probably is one of the biggest ones that we see out there. Low back.
Would you say that that's something that if you're experiencing, really get curious about physical therapy?
I think get curious about physical therapy. I think, I think get curious about like other activities that you can do. I mean, talk to your friends and neighbors. A lot of people have gone through it, so they might have tips and tools, or even, I mean, your podcast, like what are some great things that I could potentially try? Do I get involved in maybe a little yoga activity? Do I try, is it dietary? There's no catch-all, but I think, like you said, you get curious about seeking out information to help make you better, because the last thing we want people to do is not do anything. There's so many great things out there. You do have to be persistent with it, because you will find something. I mean, it's amazing what people do. There's tons.
Mm-hmm. There's lots and lots of resources, which is why I started this podcast, because I would talk to so many people and ask so many questions like, okay, I've got to get this out on a broader scale, that there are so many solutions out there. You know, don't feel stuck. If you feel stuck, find someone who's maybe the researcher, you know, that's something that I do as well, or find a wellness coach, someone that is connected to these resources and can help you think about that. Because that's, you know, some people, that's what they're crazy about, and that's what they do.
Right. I was at a class one time, and this was really interesting, because not only are we a clinician, you know, or for you, like working with your podcast, but we become then curators for people and resources to actually help and be like, hey, I've heard of this, and this. And so we do want to try to share that information with people and not hold it back. So I always have kept that with me. It's like, we're not maybe going to be able to heal every single person out there, but even if I'm able to give them some form of information to continue forward on their journey, yay, we succeeded.
Well, I so appreciate all that you have shared. Do you have any parting tips or advice, and how do we learn more about you?
I think the biggest thing for people is to keep moving, keep pushing, keep looking for interventions, practitioners that may help you through your journey, because the good ones will be out there to try to provide you as much information as possible. But hands down, keep moving, keep your body going. You can also reach us we have a website, so it's www.motioncare.com, and we have a Facebook page, so you can reach out that way. Or the greatest thing is our staff is always willing to provide information, and or you can talk to a therapist too to get a little more information. It's always nice when you come in for an appointment because we definitely have more time, but we try to give as much information out as we can at our clinic.
Well, we have definitely gotten wonderful results, and you became highly recommended. And you're just north of Minneapolis, so just give some reference there. You can drive in or fly in.
Yes. Yep.
Thank you so much. I really appreciate you joining me today and taking the time.
Yeah, thank you for having me. Sorry about the dog bark, but
this is a low bark, so that helps.
Yes, so sorry about that. But yeah, thank you for having me. I very much appreciate it. It's always great to talk to you.
You too. I'll see you soon.
All right. Take care. Bye.
Thanks so much for listening to the Weight Free Wellness podcast. Remember, the next time you're on Facebook, LinkedIn, Twitter, Instagram, pretty much any of those places, YouTube, of course, subscribe and say, hey, let us know what you're enjoying, what you'd like to hear more of. We'd love to hear from you. And make sure to take advantage of our free classes at weightfreewellness.com. I have my body typing quiz, and we have lots and lots of goodies, more goodies coming your way. So take care, everybody. That's at weightfreewellness.com, of course, right? You knew that. Okay, have a great day. Bye-bye.